The various types of treatments for cancer first begin with being able to pinpoint where it is. Dr. Jason Bailey of CMI Radiology gives us the details on PET-CT imaging technology and how it helps doctors determine which type of treatments are best for patients with cancer.
So PET-CT really combines two separate technologies, PET and CT. CT is probably something people are more familiar with. It's pretty much a fancy X-ray that goes in a big circle, and then a sophisticated computer can take all that data and turn it into a 3D image of someone's body. It's a picture of someone's insides, which is the way I like to think about it, because you realize how amazing it really is. And then we have PET, which is a little bit different, probably a little less intuitive. We can take usually FDG, which is the tracer we use. Tracer really is just the thing that we can image. But FDG is the most common one used. It's really just a sugar that we change a little bit in order to be able to image. So we inject that, and that will go often predominantly where cancer is, because cancer is pretty aggressive, and so it needs an energy source, and sugar is often that source. So when we have something imaged that is where cancer is, and then we have the CT component, which shows us the parts of the body, we can see, oh, that's the part of the body where there's cancer, whether it be the lung or the liver or any part. Ultimately, you're trying to treat, right? You don't just want to have information, you want to know what you can do. And the mainstays of treatment for cancer are chemotherapy, radiation therapy, and surgery. And we can see how much cancer there is, where it is relative to other structures with the PET-CT, and that helps us choose which treatment or what combination of treatments are best. A radiologist is kind of a funny kind of doctor, because they don't really interact with patients that frequently, but it's actually the radiologist who's interpreting all imaging studies, and the radiologist has looked at literally thousands of imaging studies over their training, and then thousands more during their career. And so what would look very confusing at first to patients and to a lot of doctors, to the radiologist is something they've seen over and over and over. But PET-CT really revolutionized the way that we diagnose, stage, and ultimately treat cancer.